Hello and welcome back to the Modern Pain Physician Podcast. I'm your host, Dr. Joe Kent, a board-certified interventional pain physician here in Bend, Oregon. And today we're going to talk about different types of radiofrequency ablation. So essentially radiofrequency ablation is burning something in the body. And this can be done on several targets. Some people may have heard it done for the heart, for things like atrial fibrillation. In the spine world, it's typically done for one of two things, either arthritis of the facet joints or degenerative discs. And what I'm talking about here are the facet joints are these tiny little joints in the back of the spine. Degenerative discs are on the front of the spine. And so the radiofrequency ablation to treat these structures is either burning what's called your medial branch nerve, which is in the back of the spine, or if you're doing the Intracept procedure, you're burning the Basivertebral nerve, which is actually inside the bone of the spine. As far as we know, an Intracept radiofrequency ablation of that Basivertebral nerve is permanent. The studies that they did, they followed folks out for 5 years, and the pain relief that they obtained was basically maintained through that entire 5-year period of time. And so we think it's permanent, and it has to do with the structure of the nerve itself. But that is in contrast or in difference to the facet radiofrequency ablation, which is probably 99% of what people hear about for burning nerves in the back. Those are not permanent. Those come back, they last 6 to 18 months. And so there are some differences between Intracept basivertebral nerve ablation and facet radiofrequency ablation. It's a different structure, different nerves that do last, different varying amounts of time. The facet radiofrequency ablation can be done in the office. It can be done in an ambulatory surgery center. Typically don't need a lot of sedation, more of just kind of light sedation for those procedures. There's lots of numbing medicine involved. Intracept procedure, on the other hand, because it's more invasive, since you're actually going through the bone into the front of the spine, is done with anesthesia. And so there are folks that do it with general anesthesia. I personally do it 99.9% of the time just with basically MAC anesthetic, which is a monitored anesthesia care. But that is needed because you're unable to numb up those structures, and so you need to have anesthesia support for the Intracept procedure, just for comfort. The Intracept procedure is currently on label, meaning it's only been studied from L3, L4, L5, and S1. And so there are 4 levels that are currently on label. And there are some nuances in terms of insurance coverages for the procedures. I live here in the Pacific Northwest, and the Medicare administrator, Noridian, only allows me to treat 2 levels per surgery. And so that does limit, how many we can treat per surgery. But they can all be done. If you live in upstate New York, you can get all 4 done at the same time. So there are some differences based on which region you're living and where your insurance is located as far as number of levels that can be treated. Off-label, the structures, the vertebral bodies higher up in the spine can also be treated. You have the same anatomy, you have the same pathology. It's just currently not covered by insurance, unfortunately. And I think the company eventually will do the studies to be able to do Intracept higher in the spine. But there are some nuances for that Intracept procedure as far as what levels that can be treated when covered by insurance. For facet radiofrequency ablation, those little joints in the back of the spine, those can be treated basically from the neck all the way down to the low back. And so there are no off-limit areas of the spine that can't be treated with that procedure. Typically, insurances will let us treat 2 levels per segment, and how they, or per area, how they determine, they group the cervical, neck, thoracic, mid-back area into one segment, and then lumbar and sacral in a different segment. So you can basically have 2 levels treated on both sides, in any segment at a time. And so, and that, like we talked about before, that lasts 6 to 18 months. So again, it's not permanent. And then, a lot of questions I get about, success rate for any of these procedures. Success rate all depends on is that the actual pain generator, which for the folks that, you know, have been in dealing with back pain and neck pain for a long period of time, you know that sometimes it's not cut and dry. You know, back pain, neck pain can come from several different structures and sources. And so, you know, if the pain is coming from the source that is being ablated, then it will work for that problem. But that is not it is not common that is the only problem people have. And so you never expect to have 100% pain relief, though there are some folks who get that. In those folks that do get 100% pain relief, that just tells me that that was the sole source of the pain in that area. And so people that get less percent relief just tells me that, well, there's pain coming from other areas. And that's why you know, we look at several other sources of pain when we're evaluating spine-related pain. So I hope that helps kind of clear up the difference between facet radiofrequency ablations or nerve burning procedures in the spine and the Intracept procedure, which is the new type of nerve burning procedure that treats degenerative discs. Take a look at my other videos for other information regarding other ways to treat pain and what other, you know, other causes for pain for the spine. Have a good day.